can we please welcome our special guest, Hill? Welcome. I like your spelling of
Hello,
Doc
James.
as
Hello, how are you?
Heal.
Itchy.
How how do you feel about iDoc? I guess that's the number one question when you first
Mm,
got to know about it.
yeah. So I think it's a wonderful, wonderful device, amazing. So when you first showed the machine, I thought this was just a cell phone. So,
Okay.
eh, what kind of cell phone is that?
Yeah.
So, but then it's as you started to explain its amazing features, then I really realized that it's a very important device which will be of help to all kinds of people, the poor, the rich, and everybody, because everybody of all of us can get sick. And getting sick really is very hard to encounter or to experience. And so, as much as possible, we don't want to get sick. So, in our parlance, James, um, bawal magkasakit. So, you should not get sick. Bawal magkasakit, no, as much as possible.
Yeah.
And true enough, yes, we have medicines. We have lots of the Western culture has taught us how to treat medicine, this kind of diseases with the medicine. So, and also, of course, there are probably three kinds of things that we can do for any kind of disease. Number one, medicine. Okay, number two is operation, and number three, we can do some laser surgery or radiation surgery. Okay, so radiation on that. So these are the things that, especially for cancer, all of these have been introduced to us and showed us how we will be able to come up with good health, better health. But of course, not all can be answered by these three modalities. So of course, me, I was trained under the Western medicine. So, but somehow, since a long time ago, I started to imbibe some parts of the integrity, the alternative, what you call, or things which coming from uh, the eastern part of the world. So the Eastern medicine, that. So a
Yeah.
conglomeration of all of these things can probably help me in diagnosing these diseases and in treating this diseases. Okay, so and
Thank God you kept an open mind, and that's why I
yeah, yeah,
know that's the very first time I saw you. You were very fascinated with this gadget. I think we went to the Philippine Medical Association in Shangri-La. We went to GMA, right? And then
yeah,
you saw me going around diagnosing people, and you were looking at it.
yeah,
And then
yeah,
later
yeah,
on, I think because you come from a background, you were UP graduate, and you were doing lecturing, and you were asking me for a lot of materials, and that's something that really impresses me. And you did your own research more about the product as well and the
yeah.
efficacy. And tell us more about it. What did you find?
No, actually, I wanted to look into this product and how it became a US FDA approved. And I had some, initially, I had some difficulty, but then finally I found out that initially this product was for pain. So, and then I saw the white paper, which definitely told me about what Aculife is or what this electric acupuncture is. So,
Mhm.
and then it helped me uh, realize and what this small device, very helpful device, can be can do to our countrymen and to all of these people who are sick. So indeed, this is that was a thing, something which I looked into, and basically it started with the pain, how to manage pain using the electroacupuncture. And so, and furthermore, there were off-label indications for this, and one of these would be what you have. So one of these is tinnitus. One of these is also how to relieve your thyroid problem, how to relieve your throat problem, your heart problem as well. So eventually, there were a lot of um, indications for uh, for any kind of disease. And just like acupuncture, the acupuncture initially also started that way, and then eventually its indications were varied, became diverse, until finally, initially, in fact, it was not accepted in the US, and but now it's readily accepted by the USA, and then that's why it has a USA FDA approval.
Yeah,
Not
and
just USA, then the other parts of the world as well.
yes, and
Yeah,
interestingly, Doc, is aside from the acupuncture thing, this is really wonderful, isn't it? You know,
yeah.
so this is
So that's
a
my
new
favorite.
technology. It's a new technology, and in your, I don't know, so many years of experience, you have seen countless a number of patients with
Mm.
in your specialty of ENT. How do you see the acupuncture and the TAVNS being able to help some of your patients?
Yeah. So of course, I have been trying to. I've used that to a lot of my patients, especially those who have been sick with indicated for transcutaneous auricular vagal stimulator. So and uh, and basically, in my field of specialty, I use it for allergy. I use it for throat infection. I use it for thyroid disease, and also for hearing loss, and also for what we call tinnitus or ringing of the ears. So indeed, there are, especially with tinnitus. Tinnitus actually is a very hard to treat. And once you have it, sometimes you can say that it's there's no treatment. Most doctor would say no treatment for tinnitus. Okay, so what we've tried, there were some medicines given to us. They were discovered for us, like ginkgo biloba, combination of ginkgo biloba, zinc, and the vitamin B12. So all of this can help, and also some form which will help you, like melatonin can also help. So, but definitely not 100%, not even 50%, not even 20 or 10%. So definitely very low with regards to the treatment with any kind of medication.
Wow.
I, yeah. So really, tinnitus, ringing of this, very hard to treat. Now, what are the causes? Now, let's review the causes. Okay? Number one, it could be due to aging. Okay, so as we age, probably we have some problem with your ears. Probably we have hearing loss, and this hearing loss is a concomitant ringing of the ears as well. You probably have history of loud noise exposure, things, and this could be when also when you have you are in a firing range and then you do not protect your ears. So definitely you can have this also this kind of problem of the ringing of the ears. Okay, if you have trying to have medicines like antibiotics, like chemotherapy drugs, and diuretics. This can also cause the ringing in the ears. Somebody's trauma to the head and neck, and then it probably can cause problem with your ears, and this can also cause ringing of the ears. No, because basically the hair cells inside our ears can be very can be very can be affected. Okay? And once it is affected, there will be decrease. There will be ringing of the ears eventually. So
Wow.
those are some of the things that we need to know, okay, how we can have this, and definitely there are risk factors. Again, the risk factors will be intake of medication, and once you uh, become aged, possibility of hearing loss, so it's concomitant, or with hearing loss plus with the ringing of the ears. So those are the things that we need to understand, and basically the mechanism actually, or the root cause, the very dynamics of this sometimes cannot be explained. It can be idiopathic, or it can be it can be the cause, it can be unknown, no? But basically we're trying to explain to you this way, the risk factors as well as the complications or these things that we know that which we call tinnitus.
So
Mhm.
definitely, Doc, this is a big blessing to a lot of people with tinnitus.
Yeah, yeah, yeah.
And in
Yes,
fact, according to ChatGPT, when I did it yesterday and I asked
yeah,
the
yeah,
question, it says that there are 10 to 15% of people around the world, adults, with tinnitus problem. And I say, wow, that's a huge, um,
sometimes even 30%. Some reports as 30%. So
and
about a third of the population, global population, has this kind of problem.
my goodness.
So in big,
I actually had one lady, and it must be really ringing really loud. Like I don't know, it affected her sleep even. So yeah.
yeah,
I'm sure
yeah,
I'm sure there are many,
definitely. It
yeah,
can cause sleep disturbances. Once
wow.
you definitely can be one thing that we need to know as well.
So even when you sleep, it is still buzzing away. I mean, the ringing.
Mhm. Yeah,
Wow.
yeah, it's still there, and I have some success stories with the medication, but not
Okay.
definitely not as high, not that high. Okay? So I
Mhm.
can say about 5%. Okay, especially with the medications that I mentioned. But
Mhm.
basically, there are really a lot of things that we need to know. If you have colds, if you have colds, you can have tinnitus. If you have eustachian dysfunction, especially when you fly and then you go down, and then when you're down, probably there's problem with your ears, and this problem can cause what we call tinnitus initially. And these are easy to treat, especially if you have colds. These are easy to treat. Once the colds are gone, you're okay. Okay. But another thing is that if you have earwax in your ears, this can cause also the tinnitus, the ringing in the ears. And once it is removed, then eureka, you can now hear everything.
Basically, you need to know the root cause and then you
Then
remove
it close.
it.
Yeah, yeah.
Remove it.
There's a multifactorial perhaps, but I think we need to know what's the real cause,
Yeah.
what's causing this kind of problem. TMJ, or temporomandibular joint problem, can also cause ringing of the ears. Okay? So you have to also look or seek the help of your dentist. Probably they may help. Okay? They may give you some assistance, and they may give you some help.
Yeah. I guess
Okay?
I mean the teeth and the nerves are all connected, isn't it?
Yeah,
Anyway,
yeah.
thank you so much, Dr. Hill,
Yes. Yep.
for enlightening
Uh,
us and for being with us and for being an inspiration to
yeah.
me and many people